Thank you so much, Varun sir, for joining us on a podcast at Dawdle. Extremely delighted to have you, an hospital leader who comes with so much of experience. And most importantly, it's for the first time that we are actually hosting a hospital leader who has seen a lot of public health, thing as well. And you've been a part of Sri Gangaram Hospital, which is such a prominent hospital in Delhi, and people from all across India kind of travel to Delhi to, kind of seek the help of doctors over there. We welcome you, sir. But before we start and picking your mind on various topics, would you mind if you take 2-3 minutes and introduce yourself?
Thanks, Rishikesh. Thanks for having me here and giving me the platform to actually share the thoughts about what right now the healthcare is, how it is going about, etc. So far as my background is concerned, so I'm an out and out healthcare player. I have been on supply side of healthcare, which is basically pharmaceuticals and device, where I began my career and graduated to the provider side of healthcare, which is hospitals. So that is briefly. I have worked across corporates. I worked with Sanofi. I worked with Reliance. I worked with in my provider side. I worked with Fresenius. And on the hospital side, I worked with all the corporate healthcare players like Fortis, Manipal, and part of me on a consulting side from a McKinsey side in transformation project to Amri, Calcutta. So we transformed that. And I've been part of Apollo, which is one of the prestigious project where I had to deliver Prodon. And then coming to this side, Gangaram, in a capacity of, so throughout that, I have been in a capacity of a leadership where I could contribute significantly and could also bring about something new to the healthcare while healthcare continues to evolve. So that is the background I come from. By qualification, I'm an MBA and I have been part of a strategy, operations both. And over a period of last 15 years or 16 years when I have been part of this side is that I have seen a lot of transition that has happened, in terms of how the care and how the hospitals function, the care is being delivered. So that I am fortunate enough to be part of that evolution, which is now is being seen across by, earlier it was limited to some extent to the doctors and to a management, but now it has percolated down across the stakeholders, including the patients. So that is what I have seen. That's what the background I come from.
Sir, first, it's a very general question, but what are the major, digital transformation initiatives that you see happening within the hospitals?
Okay, so let me tell you that earlier, so see, the word digital is pretty a big, big word, and despite being a big word, it still remains, one part of the technology, right? So what is happening is in terms of a digitalization of, hospitals. So let me create a bucket, before I come to the core question of yours. See, the first bucket is the operations. Hospital is an operation intensive industry. If you look at it, the amount of transactions, the amount of things that happen every day, oh, huge. It's very intense, and it is earlier it was oriented by man. So you could create a hospital, you could get in a doctor, you could get an operations guy, and they were running through a one software, and the doctors were doing their, it was completely manual. Over a period of last 10 years or 15 years, what has happened is ever since technology has started growing, is that every aspect of that operation is getting digitalized. So I give you an example that today you have got a software which is HIS. HIS was just one bit of a piece. Now on that HIS, you have a lot of applications sitting now, right? Which is automated billing. That is one part of that. You have the technology is evolved, so you have a speech to text. So one part of the operation was a doctor summary. So now you got an Ognito kind of, softwares where you just speak and the summary gets typed and it directly flows to, it is digitalized summary directly flows to the billing desk, right? So they don't have to wait while, you are actually settling the patients or preparing him for discharge, etc. and all that. Another aspect of that, you have no physicality. Now you have a website or you have an application where you're uploading everything and it is going 3 in 3 hours or in 2 hours because there is an insurance patient, so that is also coming to you or clearing it. That is just one bit of your operations. Now I give you another example of that when I come to the care side. So today you have a beds which are software driven beds or which are sensor driven beds. Now you see, suppose if I have a patient is lying on the bed, so you need the parameters. You at least need the 5 parameters while the patient is admitted, while you do the risk categorization and all. So what has happened is now the patient, you have a sensors below the mattress of the patient, and the patient is lying there. Those sensors are actually measuring the 5 parameters which a doctor needs, so that the so long the patient is inside the hospital or inside the room. So that those 5 parameters, whether it's a blood pressure, whether it's a saturation, whether it is, rest of the parameters, directly going to the desk where the nurse is sitting outside, and nurse can through that come to know about it, whether the patient is on the bed or not. And if the patient is on, what are the parameters? So if there is any parameter, the alert directly goes to the doctor, and doctor knows that this patient is happening that, and the nurse doesn't have to physically go in, and she looks at that, and she knows that what is happening to the patient, whether it require monitoring or it doesn't require monitoring. So that is one example on a care side. There's a one example on an operation side, right? Now, as I said, that the hospitals are intensely operative. I mean, operationally very intense. There's a lot of work that happens. You have softwares. So like you have a, service excellence. So you have your tab in your hand. You go to a patient, right? You take the feedback, and the patient speaks, and it automatically captures the feedback, and it directly goes into the buckets of excellence, and you exactly have the data that this is what it is. The patient is, which is the pain point, where the patient is happy, where the patient not happy, where the patient is, actually categorizing your experience, in terms of excellence, in terms of good, in terms of that, and that comes to you directly. That is a second part of that. Now you earlier had a lot of restrictions in terms of, who is going in, who is going out, right? So you had to have some amount of a control, and that was being done physically by the security. Now you don't have to do that physically, because the moment patient comes in, then you actually generate a token, and the token is basically barcode read, and you give it to the patient, and they know that this is what it is, and it reads the system, it goes there. And most importantly, so you have an asset, because hospitals spend a lot of money in terms of creating asset, whether it is a wheelchair, whether it is a stretcher, whether it is this. So what you do is, now through sensor-based technologies, you map every asset of yours, right? You have companies like Portzo, Treatwell, right, which provide you those services, and your entire housekeeping staff, GDA staff, people who do these services, they have that tab, which is a battery operated. They have got an 8-hour shift. It's very stable. You give it to them. What happens is that the assets are measured. Nurse is there. That flows into the system. If nurse need a GDA, she can just put a message there. It automatically goes to the nearest one, and that person comes and does that work. That person wants to know whether there is a wheelchair is required, a stretcher is required. He exactly know where the wheelchair is lying, which one is free, which one is not free. So he gets you and that is on the basis of the distance, that this is the nearest one which is free, and he gets that. So that's a third aspect of while you are providing the care inside. So you look at the three different examples, whether it is in operation itself, whether it's a patient side, or whether it is a employee side, etc. and all. So all this is examples of digital, right? So you look at the degree of digitalization that is happening, and that's the way forward, because you need to actually get that technology, because you need to make your operations very smooth. You need to make your operations very efficient, because every transaction has a cost. So if you have to really manage the cost, what you need to do is basically you need to bring in efficiency. When you bring in efficiency and you optimize your operations, that's where you actually reduce a lot of cost. When the cost gets reduced towards the patient side, the cost gets reduced towards the P&L side when you are running a hospital, especially the large hospitals. So these are part of digitalization. These are part of automation, and through automation you're bringing digital. That's a one part of it. Then you have your all EHRs, your all summaries. Now nobody uses paper in a hospital. So if you look at modern hospitals like we had in Apollo, is that we make it as paper free as possible. So up to 95%, 96%, the hospitals or operations are now patient free, paper free. You don't have to use them. So you have a strong software, which is an HIS. Then you have a medical software where the doctors are writing this. You have automated drop down menus in your prescription. You have e-prescriptions. Those are flowing directly to the pharmacy getting you the medicines. They're flowing directly to the number, which is part of your EHR, which is the patient loads your hospital's website, application. In that, your entire history is coming into that. So when I have to sit digital, or automation, this is exactly where every hospital operations are going towards it. So technology is now deciding that how efficient you are. It is one, on the one side it is enabling you to produce more amount of a work in a given hour, which you do the time motion and all that, so it's improving your productivity. At the same time, it is helping you sort out the loose ends which were actually disturbing the care, and or which were making the care disjointed, where patient or the attendant had to speak lot of times to different people. So that was earlier happening. So
Yes,
those things are now the thing of the past because of the
got it.
technology. So this is so enabling. So that's my answer to your question
Yes.
when you are asking about the digital and all.
Sir, one of the things that is very important, if you see the P&L side of the hospitals, like per bed revenue is usually being, talked about, like what is that hospital earning for every bed. And in that case, I think one of the things which become important is proper utilization of bed. And there the concepts of like remote ICU and all these things are coming up. Would you like to throw some light on that, sir? Like your views and what are the risks associated with them?
See, generally what I have seen is what people talk about. It's that the technology is going to be costly. It's not costly at all. So far as the PNL side is concerned today, technology is an enabler to get you far better productivity and a far better EBITDA, because it is not substituting people, but it is making people far more productive. Hello.
Yes.
So it's making people far more productive in terms of operations, because see, operation is all about cost,
Yes.
and there is a lot of leakage in that cost. When I say the leakage is the, or the waste is in the cost, because how are you going to allocate? So generally if you look at it, hospitals will have a 1 is to 3.5, 1 is to 4 is the ratio of a manpower that a typical tertiary care hospital will have it, right? But whether that 3.5 or a 4 is giving you the productivity that you want to have or you don't want to have, right? Or whether you desire to have it or you don't have it. So the enabler that you have is the technology today. So if I tell you that if I physically, the doctor earlier was writing summaries, discharge summaries was taking, a 10 to 15 minutes of today that discharge summary gets prepared in 3 minutes. Going forward, that will require probably no intervention at all. It'll just require a doctor's eye to look at it, whether it is done or not, because it is going to directly flow from the document that you have created through when the AI comes in, or the more AI you involve in operations.
Yes.
So this is how, so you are freeing up doctors time and the doctors, or everybody's time to do something which is far more critical for you to do, or allocate your time to that. So that's where the productivity, the technology produces productivity, and it directly flows into your EBITDA, or when I have to speak to that. So because of technology, at least your EBITDA improvement, it contributes to the growth of EBITDA, it contributes to the EBITDA itself, at least in the realm of, if I have to do a back of the envelope calculation, if the productivity goes up by 15 to 20%, even your EBITDA goes up by at least 1 or 2%. That's the technology which actually enables you to have a better operating margins, because you know
Right.
the wastage and you know how to deal with that wastage. Earlier, without technology, you didn't even know that what wastage you have. So today you reduce the wastage, it actually gets reflected into your EBITDA, or
Yes.
probably or apart from that, it also help employees actually allocate their time and their efforts towards the right cause.
So would you also like to touch upon a few challenges on the supply chain side, like, in the procurement supply chain of consumables or devices? What are the challenges over there and how technology is basically helping streamline that?
Oh, that's the completely technology play area nowadays. See, earlier we used to have a lot of supply challenges. We didn't actually know that how, our inventories are at around 18 days, 21 days, or 27 days, which are the inventories which are above 16, 60 days, etc. And all our cost is sitting there. And more than the cost, then the inefficiency is sitting there. Today, actually, that problem to a quite large extent is sorted out. It's only about now how goods are flowing. We know that now 18 days of a inventory was the norm. Now we are trying to reduce it to 12 to 13 days. It is so dependable because it's all driven by technology today. Whether you want a dashboard, you want a dashboard of the drugs that you have, a dashboard of the consumables, you want a dashboard of or the items which are on a challan, they also get mapped through supply chain or through these through the technology today. And I think going forward we even have a better when the blockchain comes in. So
Yes.
all kinds of leakages, all kinds of these things will go away the moment you will have an adoption of blockchain into supply chain, or into linking it with the EHR, etc., and all that. So that's a humongous area. That's a humongous, I would say a comfort that technology has given us in supply chain. Supply chain is all driven by that, technology today. It is no more driven by the man is only there to actually handle that. So at a dashboard, I know that today, okay, my last month, my consumption of antibiotic was this. This is the inventory that I have in this. This is what we do it today. At the click, I know the dashboard flows to me in the morning that I know exactly this is the state of the supply chain that I have it. So earlier it was actually in the corner. Today it is on the desks of everyone, right? So it's so visible. Technology has made actually it is a visible to the entire management, to the entire hospital, or anybody who is involved in the care. He knows what it is lying, what is lying there, what is not lying there, and how soon it's going to be available, etc., and all that. So it's all thanks to technology, and that is contributing a lot in terms of that. Our, tertiary care hospitals used to have roughly at around 28% of their uh, you know um, medical consumable on that cost, and because of technology it has come down to now 23-24% at the max. So you look at the jump that you have it, and then your negotiation time has gone down. You don't have to spend, your supply chain guys don't have to spend so much of a time in negotiation, because exactly they know the consumption pattern, exactly know the, in terms of which drug is flowing, how, whether it's becoming costly, not costly, etc., and they can negotiate it and can get it. And all mostly the vendors have also actually graduated from a being vendor to a strategic partner, and all thanks to technology. They also have, it's like so you take an example of, automobile industry, where the vendors are basically part of the production system, right? Because they are supplying all the parts, etc., and all. That's how the car is being manufactured. Exactly the same thing is happening through, because of technology in healthcare now. So what has happened is that the 70% of the, supply chain material that we require is through technology. Now these vendors have got an engagement for 2 years, 3 years, etc. That's how the negotiations have moved, and they've become part of that. So there's a huge dependability, and that is coming from technology.
And quality checks and everything is
Rather,
integrated to that technology.
yeah. See that without that, it doesn't just move. So you have a full-fledged quality department, which is digital quality department, that tracks all the data. That in fact, when you look at it, the pain scores, etc., and all that, and the medicines that you are using, which company it is coming from, where it is, at the click of the button, you have everything there. So in fact, I would rather say now we have over a period of last 10 years, now we are at a critical juncture so far as the technology is concerned. But earlier you used to have hospitals, or the, businesses, or a hospital which was running smoothly with the little bit of a technology. Now what you have to do is, if you have to set up a hospital, or today you have to keep the tack first. Tack is the spine. It's like you imagine your body, and without spine, can you move? No, that technology is now the spine of every business that we are doing, every transaction that we are doing inside the hospital. Whether it is a patient coming in, inside the emergency, getting triage, and then moving into, either ICU or an OT, or in a room, everything is through this, or technology. So that's where we have moved in. And mind you, I would say that still we are at a very, very nascent stage. Still, we are at a very, very nascent stage when I am talking about it. So evolved structure of a hospital, where you actually doing everything to technology today, but we are still at a nascent stage.
AI driven models, which basically are now predicting the population health risks, are they also integrated with the hospital system so that hospitals can be well prepared?
Absolutely. That's an excellent question, I must say, because this is where the future is. See, what is happening is the capacity. See, you have to understand it at an industry level. If you look at it, the capacity is limited. India, and let me talk more about in from an Indian perspective. India still needs 30 lakh more beds, 3 million more beds, tertiary care beds, given the kind of population that we have and the disease incidence we have. And what we saw in during COVID actually was that we didn't have the beds, and we had so many patients at that point of a time. Technology is the only answer to do that. And AI is going to be actually, so if you look at national digital health mission, you know, Ayushman Bharat, etc., and all that, when you talk about it, and when you talk about a larger population, see what it is getting integrated in hospital operations. For sure, it is getting. And without that, I don't think that in a country of a size of India, it is going to be possible for any healthcare actor to sort that problem. What is this? Today, if you look at it, our healthcare model or a hospital is basically an episodic. It is a reactive model, something that has happened after that you are trying to treat, right? This is exactly what happened in COVID.
Yes.
Imagine a situation from a reactive to predictive.
Yes.
Before the disease happen, or if it is initially at an initial stage, if you can, you know exactly this is what it is, your response is much better, your capacity is much prepared, you know what exactly to be done or not. That's where the AI is going to play a big role. This this is already getting integrated, right? It is getting integrated through various mechanisms. One is that the hospital, its neighborhood, its own patients. So you see, there are two pronged answer to this. Is one is that India is now becoming a hub for chronic diseases. So it's now the capital for cardiac, it's capital for stroke, it's capital for cancer, it's capital for mental health. All these are engaged disease, which actually over a long period of time patient need to remain. So you need a lot of predictiveness, how you're going to deal with that. So that's where the AI is going to play a role. Second thing is, you look at it. So I give you an example, a very small example today. Suppose if I were to put sensors which are going to actually detect microbiomes like viral or bacteria, etc., in the drainage system of the city, right? Have the data where the which microbe or which bacteria or which virus is growing where, which can turn into an epidemic, and predict, and share that information at initial. These are the clusters. So I'm identifying clusters. These are the clusters where it is developing, and give it to the hospitals. This information is there, and then the hospitals are prepared. This is the kind of bacteria that is developing. This is the kind of virus which is getting developed. It is going to be a catastrophic epidemic, pandemic, or it is going to be a disease which is going to spread in this cluster, and all hospitals are capable enough to treat that, so they can do that. That is something that happens in Delhi. I'll give you a live example of that. So now you know that summer temperatures 2 years before, actually, 48, 49, and all those things, the people are coming with the dehydration and all that. The hospital since knew that it's the temperature is like that, so they prepared their cold response, that the moment patient comes in, put it into this, and all, they were prepared, like emergencies were, triages were prepared like that. The second thing is, today in Delhi, the emergency preparation is in winters. You know that it is going to be a lot of smog, etc., and also you will have this kind of chest issues are going to come. This is what has to be response. Every hospital's emergency triage is prepared to have a pulmo resuscitation, etc., etc. So these are just models which are getting integrated now because of the productivity, preparedness of these hospitals, because of the AI technology, etc., all getting into that. So that's a way forward. What you have asked is basically every hospital, every chain has to be like that, because one, that India cannot afford to have, I'm talking about overall world, but more so in India, you cannot afford to have to become a capital of that. For that, you have to become from a reactive model or a responding model to a predictive model. Then that is only possible through technology, because you don't have the kind of wherewithal, the kind of doctors, the kind of nurses, the kind of manpower. Right? You can solve this puzzle through technology, whether it's a loss of life, whether it's a wastage of money, etc., and allocate that money more towards technology or more towards other things, so that you can, and you don't have to build the kind of capacity that you need, at least over a period of, immediately today, if you were look at the population to bed ratio, you actually require 30 lakh more beds, which is huge capital, right? But through technology, by changing this model, you can reduce that. So that's where the technology is taking us, and that's where the hospitals, that's why the hospitals are integrating themselves into, through AI and all that. So it's
So the
happening.
another, yes, the another one is on basically, these virtual hospitals and digital health platforms. Can they reduce the strain on the traditional hospital systems?
Absolutely, absolutely. Because see, look at this. You have a teleconsultation today. You have a assisted. So you have got a EICUs. You have a virtual consultations. Whether you do it through what platforms, they are going to reduce, because this primary care and the secondary care, for which earlier the patients were coming to OPDs and all this, is being sorted out through all these digital healths. It's an established platform now. Whether it is a DM Aster, whether it is a Care, whether it is Apollo, whether it is Medanta, whether it is Fortis, whether it is Ganga, everybody is having those information center in a and it solves your biggest problem is of access. In India, the healthcare is an island, so you have got a 12 cities which have got a more 80% of the capacity, and then 20% of the capacity is spread across. So it's uneven distribution of healthcare in India, which makes access is a big issue, and that leads to cost, etc., and all that. That is being solved through this. So if I have, through digital health, so you use whatever platform you use, basically you are providing consultation, you are actually suggesting tests, etc., and all, right? So that consultation is moving away from a hospital at least a primary or a secondary consultation is going towards that. And that's where those models are becoming stable. They are growing, they are becoming better with internet connectivity, with adoption of technology, people being comfortable with technology. All this is moving away from hospitals. So it's an established thing. I don't think that it requires any brainer now to understand that. In fact, it has gone to an extent now, these smaller places, which are decent places, the EICUs are being, the nursing homes are there, the EICUs are being run by bigger hospitals, and there are established companies of Dr. Diwan, etc., and all. They're running that, and it's very successful because if it is a primary or a secondary level of level 1 or level 2 ICU care is being provided in those areas. And that's a wonderful thing to happen in India through technology. That's a really a benefit of technology that we are taking today, because this is the volume that we have. This population of our country is huge, and with technology it is possible.
Yes.
In fact, I give you look at E-Sanjeevani platform, which is actually of a government platform that has given almost 10 crore consultations or 100 million consultations over a period of last 3-4 years, which is huge, one of its kind in the world. That amply proves that you require a digital. It has to be an enabler,
Yes.
and it is becoming an enabler to solve population issues, solve consultation, reduce cost, because cost is a big factor for a patient. So it's reducing. So you save on travel cost. You don't have to bring someone else along with you, because that also you have to recognize that if a person comes for a consultation, the another person who is young in the family also has to come along, and he actually wastes his productive day. That's a loss to the economy, because one productive day is gone into getting the care done.
Yeah.
So all those are, so you are saving huge in terms of contributing to the GDP, contributing to the nation building. At the same time, you're getting the care, and that's through being mediated through digital. It's humongous, established.
So you must be talking to a lot of health tech and med tech providers. Like there's a lot of startups coming in India in this particular domain. What are a few concern areas that you see whenever you meet a product company? Like, do they know your needs, or do they, just bring a product and just put it in front of you? If you could give some feedbacks on that.
Yeah. So see, that's a tricky question, because there's a lot of innovation that is happening, and everybody is having some of the other incremental advantages of something which is routinely available. So everybody is trying to come up. But what we look at, I can tell you from the perspective of, the first thing is that the reliability that we have, that we actually let someone in or have something in our hospital, is that whether it's a reliable platform or not, or whether it's a reliable, it's a big factor.
Yes.
You don't engage someone in technology for today, you engage someone for tomorrow.
Yes.
Right? So you need to do a proper assessment whether it's a reliable, whether it's a scalable or not. If it is scalable, what all it can spawn later on, what all it can create additional to do this and all. Do they have the wherewithal to do that in terms of competence, in terms of technicality, in terms of finances, etc., to build those products? Because see, understand that technology today is something, tomorrow it becomes something else. It changes every day. And now we have moved into an era where technology is producing technology, right? And there's so much of technology now, we also look at it, while that whether this solution is actually calibrated to our needs, or it's just a general solution. So we look at it, this solves this problem, this is a real problem that we have, this also can be scaled across.
Yes.
So company has reliability, company has it's see, you're dealing with a life here inside this hospital. So whether it is accurate or not, it's precise or not, right, scalable or not, they have a financial wherewithal to deal with the kind of organization we have and the kind of requirement that we will have going forward with the technology, whether they are part of that or not, whether the core technology guys, or they're just there because it is happening, so they've also come into that. So all these factors need to be considered, because we look at it, anybody who now gets to work in the hospital, we treat them as a partner, and the partner has to have enough strength, and a visibility and a vision to have that, so that there is nothing, because privacy, you're dealing with the patient, you're dealing with the life, you're dealing with the privacy, you're dealing with the security. These are real concerns. When technology is there, security is a real concern. What happened to AIMS in terms of ransomware, etc., and all that. That's a big story. All hospitals are scared of that, so you need that amount of security. You need to be constantly on a vision. Every minute you will have at least 50 to 70 attacks on your servers. So how are you protecting your servers? How are you creating your firewalls? And how that person's technology is actually safe and secure for us to do that. So all those things are part of the gamut. Everything is on the table for that. That's how it is.
So have we started using that that AI voice agent to talk to the patients, like
Yeah.
when they call for
So
doing follow-up?
yeah, we have started that. See, all that is, see, one thing is that we're giving back the power to the patient, right? The consumer. End of the day, it's a democratization of technology. So we are giving it back to them. So we are actually we have a sandbox approach for that. So we have one department where we are experimenting it, how it is working out. It needs calibration, etc., and all that. We're doing it. It was part of initially, very briefly, it was part of a COVID. Now it's a routine practice that we're doing.
Since you have been on the business side, would like to understand at last, in the end of this podcast, is that there are lots of hospitals, which are like 100 bedded, 150 bedded, but they are not doing well, in terms of profits that they're making. And there's a lot of hospitals which basically shut down as well, or kind of merge with the bigger hospitals. So what do you think may be the main reasons for these hospitals not working out?
Yes. Okay, so let me tell you that when you are looking at healthcare industry, it's evolving right now. What is happening is, to run a hospital now, patients also understand that where they have to go and all that. It's a There are multiple answers to this question. It's also a question of positioning, that how your hospital is positioned. It's a question of where you're going to get the care. It's a question of what technology that the hospital has, because hospitals have moved away from a brick and mortar hospital to an ecosystem. So today the chains are capable enough to have that afford that kind of technology, invest in that technology, whether it is a robotic, whether you are buying Intuitive's generation 4 robo, right, which is going to cost you around 200 or 300, 310 mil, 3.10 million, etc., and all that. So that is not possible for a smaller hospital to do that. It is possible for that because healthcare itself is moving towards an ecosystem. It's no more a hospital, it is an ecosystem. So you have to have a technology right, you have to have a doctor right. So today's doctor also want to operate with a lot of these things, right? They don't want to simply have a patient coming to them, do a consultation physically, and the patient does the procedure and goes back. No, because that patient needs to be engaged, and that patient may come from anywhere and may go anywhere. So today the patient is in Delhi, tomorrow the patient is in Bihar. He still wants your consultation because you are engaged, your records are with you. He knows, he has it everything on a mobile, so he wants to connect with you. You have to be available. That hospitals of 150 bedded size hospitals were running at around 10 kilometers periphery. People were coming from there. It was physician oriented or one or two doctors oriented hospitals and providing a kind of a secondary care. So that is not something that is happening now. Hello.
So in a way, what you are suggesting is basically is that these smaller hospitals, either they will become a part of the ecosystem, or it will be very difficult for them to survive on their own.
Yes, it is going. See, the model is moving in that direction, but I think there is enough space for these. If they will actually move towards more of a secondary care.
Right.
If this model works out for them, or they will shut down. So I give you a stat. They'll have to sort out their positioning, and they also have to sort out the technology, the how they want to operate, etc., and all that. It's that kind of thing. Or they will have to merge with the bigger hospitals, or they will be working as a single specialty hospitals, because
Yes.
there are some certain specialties which have moved out of hospitals. So mother and child, you see, that has moved out of hospitals. Dialysis is moved out of hospitals. You will have daycare chemo which has gone out of the hospitals now, right? 80% of the chemo is very safe now, so there's a business model coming around. Mental health has moved out of the hospitals. So physiotherapy, rehabilitation, and all, they have moved out of the hospital. So what is going to happen is, these hospitals have to sort out their issues, and they will become a niche player of a single specialty. That's where they're going to survive. Second thing is, which I feel that a lot of these hospitals will go to the corporates, and corporates tomorrow, if they want to grow, they will grow into micro markets. So I give you an example of that is available in front of you, is that, so today you have Apollo, and then you also have Apollo Spectra Cradle. What has happened to that? Because there's a mother hospital which is a high-end tertiary care. Now they need to 10 kilometers away or 15 kilometers away, there is a micro market which has all that what you want. You create a 70 bed, 50 bed, or 100 bed hospital there, and cater to the secondary care or a primary care needs from there, warm up that micro market. And if there is a robotic or as a very transplant, etc., very high end care that is required, that you seamlessly make that patient travel to the bigger hospital. That's where the model is. So it's becoming a mother mother hospital spawning children's, which are catering to micro markets, which are 50 bedded to 100 bedded hospitals, right? Doing certain specialities and certain level, surgeries, or a level, secondary level, or a low end tertiary care work there, and moving the tertiary care hospitals and, mother hospitals, you use it only for a high end service where your RPOP gets right and you get your positioning right and you do international, etc. and all. That's where the model is actually evolving towards. Technology will further change it, because technology will move completely primary care out of the hospitals. It will be at the level of home only. It will be completely and completely virtual so far as the primary is concerned. And before primary, you will have only a preventive one where the technology is going to play that. Right now, there's no business model around preventive. It is disjointed because there's a nutraceutical is different, food is different, right? Exercises, gymming, and all the wellness is different. So, which is also going to, go away further. It will get integrated later on by technology. That's where
Got
the
it.
models are actually evolving.
I think this was a very insightful podcast, sir. Like, I think we learned a lot, and I hope that a lot of hospital leaders will be watching this podcast, will gain a lot of insights. We'll also be putting up your LinkedIn ID, while we will be putting this podcast so that people can approach you and gain
So,
some expert insights from you. Thank you so much, sir, for taking out
it's
time.
pleasure talking to you.
Thank you, sir.
Right?